6 overlooked circulation signs that could explain cold feet and heavy legs. Most people think cold feet and heavy legs are just part of getting older. They blame the weather. They blame sitting too long. They blame shoes. They blame age. And sometimes those things do play a role. But here is where people get fooled. Cold feet and heavy legs can also be early clues that blood is not moving as efficiently as it should, either through the arteries that bring blood down to the legs or through the veins that carry blood back up to the heart. And after 50, this matters more. Blood vessels can become stiffer. Plaque can build up slowly. Blood pressure, diabetes, smoking history, cholesterol, weight gain, and long hours of sitting or standing can all affect circulation. Now, this does not mean every cold foot is dangerous. Some people naturally have colder hands and feet. Nerves, thyroid function, anemia, medications, and temperature can all play a role. But if cold feet come with heaviness, cramps, swelling, color changes, numbness, or slow healing wounds, your body may be asking for help. The first overlooked sign is heaviness or aching that shows up when you walk and improves when you rest. This is one of the classic circulation clues, but many people mistake it for aging or weak legs. You may walk through a parking lot and feel your calves get heavy. You climb stairs and your thighs ache. You continue for a while, then you have to stop. After a few minutes of rest, the discomfort eases and you can walk again. That pattern matters. When narrowed arteries cannot deliver enough blood to working leg muscles, walking may trigger pain, cramping, aching, or heaviness. Rest lowers the demand, so the discomfort improves. This can happen with peripheral artery disease or PAD, where narrowed or blocked vessels reduce blood flow to the legs. The CDC explains that PAD is commonly caused by fatty plaque buildup in the arteries, and Mayo Clinic notes that leg pain with walking is a common symptom. Most people miss this because they think my legs are just out of shape. But if the pain is predictable with walking and relieved by rest, circulation should be part of the conversation. The second sign is one foot feeling colder than the other. Both feet getting cold in winter may not mean much. But if one foot is noticeably colder, or one leg feels different from the other, pay attention. This can happen when blood flow is reduced more on one side. You may also notice one foot looks paler, bluish, or less healthy than the other. The skin may feel cooler to touch, the pulse in the foot may be harder to feel. Mayo Clinic lists coldness in the lower leg or foot, especially compared with the other side, as a possible PAD symptom. This is where people get fooled. They warm the foot with socks and ignore the pattern. Socks may help comfort, but they do not explain why one side is colder. If one foot suddenly becomes cold, pale, painful, weak, or numb, that can be urgent and should not be ignored. Sudden circulation changes need medical attention quickly. The third sign is swelling or heaviness that gets worse by evening. This clue often points more toward the veins than the arteries. Arteries bring blood down. Veins bring blood back up. When vein valves become weak or damaged, blood can pool in the legs. Cleveland Clinic explains that chronic venous insufficiency happens when leg veins do not work properly, causing blood to pool and increasing pressure in the leg veins. The result may be heavy legs, swollen ankles, tight calves, aching, or a feeling that your legs are full by the end of the day. Most people say, "I'm just tired." But if your legs feel heavier after long sitting or standing and better after walking or elevating them, vein circulation may be part of the problem. That sounds small, but it matters, because chronic swelling can affect the skin, increase discomfort, and make the legs feel older than they really are. The fourth sign is skin or hair changes on the lower legs and feet. Circulation does not only affect how your legs feel, it affects how the tissues look. You may notice shiny skin on the shins, less hair on the legs or toes, toenails that grow more slowly or look thicker, skin that looks pale, bluish or reddish purple, feet that look less healthy than before. This is where people get fooled. They treat it only as a skin issue. But skin, hair, and nails need blood flow too. When circulation is reduced, tissue repair and growth can slow down. Mayo Clinic includes leg color changes, sores that do not heal, weak pulse, and hair loss among possible PAD-related signs. Now, these changes can have other causes too. Aging, fungal nails, skin dryness, thyroid issues, diabetes, and medications can all affect the feet. But if skin changes come with cold feet, walking pain, numbness, or slow healing, do not dismiss it. The fifth sign is numbness, tingling, or a weak feeling in the legs. Many people assume numbness is only a nerve problem, and often it is. Diabetes, B12 deficiency, Back problems and neuropathy can cause numbness or tingling, but circulation can also affect nerve and muscle function. When tissues do not get enough oxygen-rich blood, legs may feel weak, tired, heavy, or unstable. The National Heart, Lung, and Blood Institute notes that PAD can involve leg weakness or numbness, pins and needles feelings, and walking difficulty. This is why the pattern matters. If your legs feel numb because of sitting in one position, that may be simple pressure. But if numbness appears with walking, coldness, weak pulses, slow healing wounds, or color changes, it deserves a closer look. Most people miss this because they separate every symptom into a different box. Cold feet go in one box. Heavy legs go in another. Tingling goes in another. But the body does not work in separate boxes. The sixth sign is sores, blisters, or wounds on the feet that heal slowly. This is one of the most important signs. A small cut on the toe, a blister from a shoe, a sore near the ankle, a wound that should be healing, but it lingers. Good healing requires blood flow, oxygen, nutrients, immune activity, and healthy nerves. If circulation is poor, healing can slow down. If diabetes or neuropathy is also present, you may not even feel the injury clearly. This is where people get fooled. They wait, they cover it, they assume it will go away. But a slow healing foot wound, especially after 50, should be taken seriously. If you have diabetes, smoking history, kidney disease, PAD, or reduced sensation in the feet, do not ignore foot wounds. Early care can prevent much bigger problems. So what should you do if these signs sound familiar? First, do not panic. Cold feet and heavy legs do not automatically mean blocked arteries, but they do mean you should look for patterns. Does heaviness come with walking and improve with rest? Does swelling get worse by evening? Is one foot colder than the other? Are there color changes? Are there slow healing sores? Is there numbness, weakness, or a change in how far you can walk? Second, talk with your clinician, especially if symptoms are new, worsening, or one-sided. A basic circulation check may include feeling pulses in the feet, checking blood pressure in the arms and ankles, reviewing diabetes and cholesterol risk, and sometimes ordering vascular testing. Third, support circulation every day. Walk regularly if it is safe. Avoid long periods of sitting without movement. Elevate legs if swelling is a problem. Stop smoking if you smoke. Manage blood pressure, blood sugar, and cholesterol. Wear shoes that protect your feet. And check your feet regularly, especially if you have diabetes or numbness. And remember the urgent signs. Sudden severe leg pain, one leg that becomes very swollen and painful, a foot that suddenly turns cold or pale, chest pain, shortness of breath, or sudden weakness needs immediate medical help. The main message is simple. Cold feet and heavy legs are not always just age. Sometimes they are circulation clues. Sometimes they come from the arteries. Sometimes from the veins. Sometimes from nerves, muscles, or medications. But when the signs repeat, worsen, or appear together, your body is telling you something. Do not wait until walking becomes frightening or a small wound becomes serious. Listen early. Check the pattern. Get the right evaluation. Move daily. Protect your feet. And give your circulation a reason to keep working for you. Because your legs are not just carrying your body. They may be carrying the first warning that your blood flow needs attention.